All set.
Okay, we're ready to go?
Go for it.
Okay. Hi, everyone. Hello, Curry County. Thank you so much for joining us today for this virtual town hall. We're really excited to be here. We're excited to hear your comments and questions during this town hall, and just have a good discussion here. My name is Jonathan Modi. I am Lead Communications Officer here at the Oregon Health Authority. I'm in the Public Health Division. I'll just be moderating this virtual town hall today. I appreciate your patience. I am on a phone due to technical issues, but we have folks who are with OHA who are on this call, and will be happy to answer your questions. Those folks are Kara Biddlecombe, and she is the Deputy Director of the Oregon Health Authority Public Health Division. We have Colette Young, who is the Administrator for the Center for Public Health Practice at the Public Health Division. Andre Uso is the Administrator for the Center for Health Protection at Public Health. And Tiari Sana is the WIC Program Manager. We also have on hand several staff members with OHA who will basically be available in case we have questions. They'll jump in to help answer them if needed. They include Dave Martin with our food, pool, and lodging, or foodborne illness prevention program, I should say. Melissa Powell with our acute and communicable disease prevention section. And then Anthony Nickerson, who is with our COVID response and recovery unit. So just a few things I wanted to mention. If you have a question or comment, we ask you to put those questions or comments in the chat section of this Zoom call. And we just ask that you provide your name, your pronouns that you prefer, where you live, and then your question or comment. We'll be answering questions, I should say, during this Zoom call tonight. We ask that, if you have any comments, you be patient with us. We're going to take those comments for the record, and we will be taking a look at them. But the questions we will be answering by our panelists today. By the way, if you want to submit a question by email, feel free to do so, and you can do that by emailing PhD, as in Public Health Division, .communications with an S at the end, at dhsoha.state.or.us. We also will take questions and comments on our COVID response media line, and that is orcovid19.media@dhsoha.state.or.us. And I think we'll kick it off with Kara Biddlecombe.
Great, we can go to the next slide. Hi everybody, I'm Kara Biddlecombe. As Jonathan said, I'm the Deputy Public Health Director at the Oregon Health Authority. So grateful to have you with us this evening. I just want to start out with some grounding and where we come to this conversation as the Oregon Health Authority working with Curry County, and start with our acknowledgement to community. So we acknowledge that there are institutional, systemic, and structural barriers that perpetuate inequity and have silenced the voices of communities over time. You can go to the next slide. We're committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues, so that groups can actively participate in planning, implementing, and evaluating public health programs and services. Next slide. We recognize that community engaged health improvement is a long-term and adapting process. We're striving to engage with communities through deliberate, structured, emerging, and best practice processes. Next slide. We're striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers. Next slide. We also want to acknowledge that OHA upholds its government-to-government relationship with Oregon's federally recognized tribes. And speaking from Portland, where I stand right now, we acknowledge that what we now call Portland, Oregon, and Multnomah County are the ancestral lands of the Multnomah, Wasco, Cathlamet, Clackamas, Cowlitz bands of Chinook, Tualatin, Kalapuya, Molalla, and many other tribes who make their homes along the Columbia and Willamette rivers. We acknowledge that Curry County includes the ancestral lands of Tutuni, Cow Creek Umpqua, Tolona Dini, Chitini, Chetco, Confederated Tribes of Grand Ronde, Taklama, and many other tribes who lived off the land now called Curry County. Next slide. We're here because this land was occupied and its traditional people were displaced by colonists and settlers. As settlers and our guests, we recognize the strong and diverse Native communities in our region today, both tribes, local and distant, and offer respect and gratitude for their stewardship of these lands throughout the generations. Next slide. I think I'm gonna pass over this one, but we can make sure that this is available. It's a brief introduction for what public health is, but just really briefly, public health touches a variety of our day-to-day life. So we're gonna talk a little bit this evening about things like drinking water and being able to eat food from restaurants that are licensed and inspected, being able to receive preventive services such as the WIC program, as well as having access to preventive health care. So we'll talk through that a little bit more this evening, but I do want to make sure we have plenty of time for questions. We can move on. So just briefly, what's happening with public health in Curry County? Back in April, the county government, the Board of County Commissioners, adopted a resolution to transfer their local public health authority to the Oregon Health Authority. And Curry County notified our offices and our state public health director in writing. Up until the time that Curry County ended their contract with the Oregon Health Authority, they were required to continue to fulfill certain contractual responsibilities and continue to fill the role of the local public health authority until the formal date of transfer. Next slide. So when this happens, and we do have another community within our state that has transferred their local public health authority to the Oregon Health Authority, OHA is responsible for governance functions, which is really those pieces of work for public health that formally fall within a government agency to provide. So things like licensing and inspections, for example. OHA provides the programs in Curry County that are required by statute. And we typically have done this using existing state staff and resources, potentially contracts with local partners, regional partners, and the community. And we're here this evening to hear from you about other needs, questions, and concerns that you have around public health. Next slide. So specifically in our Oregon statutes, once a transfer of local public health authority occurs, OHA is not obligated to provide or contract for provision of public health services within that jurisdiction. So again, typically we have utilized existing staff and positions based in the Oregon Health Authority offices to help support much of that work. But what we do need to do is ensure that at a minimum, we are investigating reportable diseases and supporting disease outbreak investigations. We support issuing any isolation or quarantine orders. We enforce the Indoor Clean Air Act, so we will maintain that program. We administer environmental health services. We inspect and administer the state drinking water program and offer Wic services in the community as well. Next slide. So you may have also heard that as of May 2nd, the Oregon Health Authority began providing the following programs in Curry County directly. So it's communicable disease. And so again, accepting communicable disease reports, conducting disease outbreak. And of course, this includes managing the COVID-19 pandemic. Environmental health services. So licensing and inspecting food, pool, and lodging facilities, inspecting drinking water systems, and conducting field work. So these programs do primarily occur off-site outside of Curry County, although we will have staff that'll be working within the county to, of course, be able to be on site for any communicable disease outbreak responses that are needed in person, as well as licensing and inspecting those environmental health programs, drinking water, and food, pool, and lodging facility licensing. Next slide. We also began working as of May 2nd with Josephine County to help support providing Wic services in Curry County. This is work that had started with Curry County and OHA has assumed. And they'll also be helping to support our environmental health services inspection and while OHA conducts the licensing portion of that work. And we're working closely with Josephine County's health officer, who's also been supporting Curry County for the last several months. So we're also going beyond some of those statutorily required programs that we've already spoken to and are working to continue tobacco prevention and education program, as well as the alcohol and other drug prevention program through County Juvenile Justice, where the program has been located for the last couple of years. We're also looking to support and expand partnerships within Curry County across healthcare providers to help support emergency responses to things like other future disease outbreaks, pandemics, and wildfires. Of course, that wildfire season is close upon us. And the next slide. So next steps, we've been meeting with Curry County on a regular basis since the time of the resolution adoption back in April. Curry County is working to essentially close out their contracts as well as the work associated with their serving as the local public health authority. And we will formally be transferring local public health authority to OHA on July 1st. We're going to continue to meet with community and meet with clinical partners to help make sure that we have access to other long-term clinical services, reproductive health, immunizations, and make sure that the community has access. And we'll continue to work with some of our community-based organization partners within the county as well. So next slide. I think we'll pass it on to some of our other presenters, and then we'll open things up for questions. Thanks so much.
Hi, everyone. My name is Colette Young, and I administrate the Center for Public Health Practice, and my pronouns are she, her, hers. Thanks for meeting with us today. I wanted to tell you briefly about a few programs that I attend to and how we're going to work with you to make sure that you have good public health services. The first is communicable disease prevention, and this includes COVID and animal bites. We will continue the OHA team with the partners that we have been working with throughout the COVID pandemic, as well as new partners that we're bringing in to support on the ground work. We'll be doing regular communicable disease reporting, case investigation, contact tracing, isolation, and quarantine. And as the next few months unfold, we'll be offering a few new contracts with local programs that will assist with the on-the-ground work. So you'll hear more and see more about that. In terms of school immunizations, we're partnering with Josephine County to serve Curry, and the OHA team will continue to support that work. So when it comes time to, in the fall, to enroll kids and make sure they're vaccinated, thank you very much to our partners in Josephine County for helping us work with the schools to make sure that kids are vaccinated and meeting the laws and requirements. Vital Records continues as it has for the past several years. You'll be able to go to your county clerk just like you always have. You'll also be able to access records online through OHA, either by phone or by web. And then finally, in public health emergencies, your contact, as always, is the Curry County Emergency Manager. We work closely together, and we will be there through wildfires and other disasters, hopefully not many this year, to help you and your loved ones stay safe. And now I will pass it on to Andre.
Good evening, everybody. My name is Andre Uso. I'm the administrator for the Center for Health Protection within Public Health. And this center primarily consists of public health regulatory and environmental health programs. Concerning the transfer of Public Health Authority back to OHA, there are two primary programs: Drinking Water Services and our Food, Pool, and Lodging Health and Safety Program. Our Drinking Water Services program, those duties focus on the regulation of community and public water systems. Oregon is the primacy agency for enforcing the Federal Safe Drinking Water Act, and we also regulate specific state level systems that don't meet the criteria for Safe Drinking Water Act. Those services are going to be provided by OHA staff within Curry County. They currently reside in the county, and they will be doing surveys and ensuring that your drinking water is safe. Our Food, Pool, and Lodging program, we're partnering with Josephine County to do those inspections and follow up on any complaints related to restaurants, pools, or lodging facilities. And OHA will be able to provide technical assistance to Josephine County as needed, and will retain those governance functions that you heard about earlier, the actual licensing and any enforcement that may be needed. So I'll be on the call today to answer any questions, and I also have our food safety expert, David Martin, with us today to answer some specific questions if you have some. And sorry, I'm going to turn it over to Tiara. Thank you.
Hi, good evening. I'm Tiara Sana. I am the Oregon State WIC Director, and we are going to be partnering with Josephine County to continue services in WIC Services in Curry County. So I just wanted to provide everybody a number that they can call if they're interested in WIC services. So those number, the 541-474-5333, or they can text the keyword JOCWIC to 85511. So both of those contact information will help you to get services. It'll be provided by Josephine County, but will be in Curry County. So WIC services include nutrition education, breastfeeding support, nutritious foods for low and moderate income women and children. The other thing that's important to know is that they are currently looking for locations in both Brookings and Gold Beach. So again, services will be provided in the county. All services across the state are currently being provided remotely. So at this time, most of those services are provided over the phone. So again, we just wanted to make sure that everybody was aware that WIC services will be continuing through our partnership with Josephine County. They have access to dietitians, trained WIC staff, and IBCLCs are lactation consultants that can provide services to Curry County residents. Thank you, and I'm not sure who I'm supposed to turn it over to now.
Thank you, Tiari. I believe that we're going to
If I could just jump in with a quick do-over while we are set up for questions. I was just reminded that in fact, it's the sheriff in Curry County you should be contacting during a public health emergency.
Would our team managing the questions be able to start reading those, and we're happy to have panelists respond?
Okay, great. We do have one question from Karen Knox of the Columbia Chronicle, wanting to know if there will be OHA representatives physically in the county for services, e.g. on-site WIC workers, public health workers, etc.
That's a great question. Andre, I wonder if you would like to speak to this one as it speaks to the drinking water and food pool and lodging services and how staff may be on site from OHA.
Yes, we do have OHA staff employed with OHA working on our drinking water systems, and they do reside in Curry County. They are able to work remotely, so they are present in the county and provide those duties. As far as inspecting and ensuring the safety of food facilities, pools, and lodging facilities, we are partnering with Josephine County, and Josephine County environmental health staff will provide those services in Curry County.
Thanks, Andre. This is Jonathan again. I'm now on the call, so thank you everyone for your patience. We do have another question here. Don't have a name or location, but the question is, my understanding is that this transfer of services is a 5-year Band-Aid. What support does OHA provide to our local leadership to get us back on track to be self-sustaining in the future?
I'll take that one, Jonathan, and thank you for that question. The way that our state statutes are written is that a transfer of local public health authority lasts for 4 years unless agreed upon sooner than that, in which case there would be conditions that a county government would need to meet in order to request their public health authority back from OHA. In terms of support that OHA provides to county governments, in this case, OHA is providing the support by providing the public health services within Curry County. And certainly as there are questions that may come up from the Board of County Commissioners and other elected officials about what it means to be the local public health authority and to support public health services, OHA as always would be happy to answer and support those questions, while our focus will be on providing the public health services for Curry County residents.
Thank you, Kara. Once again, just a reminder to submit your questions and comments to the chat section, and you can also email the orcovid19.media@dhsoha.state.or.us mailbox. And if you, one quick reminder, if you are a representative of the media, we ask that you hold your questions and please direct any questions to phd.communications@dhsoha.state.or.us. We really want to just keep this time open for residents of Curry County. We have another question here. First, thank you for stepping up and all your hard work. My questions are, who will assume vital statistics for Curry County? Are community members able to access the family planning program?
I can jump in with the vital statistics piece of that question. Thank you. Nothing will change with vital statistics. In Curry County, it is run out of the county clerk's office, and you also have access to your vital records through the OHA Vital Records website or through our phone number. I will pass the other on.
And I will start with regard to the reproductive health services. So as we are working to build our clinical connections within the community, we do want to make sure that we do have access points for reproductive health services. So that's going to be a big focus for OHA, along with other public health clinical services as well. So we'll share more information as we have those connections built up with the provider community.
Thank you, Kara and Colette. Here's another comment and question. We appreciate the help of Josephine County as the Chief Medical Officer at Coast Community Health Center in Port Orford. We worry about coverage in the north part of the county as a partner for VFC, or Vaccines for Children, and the CARE program. It would be ideal to use resources already in the county. What are your thoughts on that? And are you limiting partners to just Josephine County?
Why don't I jump in on that one? Thanks for the question. We are not limiting partners. We're excited to be modernizing public health with as many community partners as possible. And so we're trying to think broadly about who can really serve the community, who can get to the places we need to get to in order to make sure that everyone in the county has access. So we're open to ideas and looking forward to talking to you about that.
Thank you. Just another question. How many extra people did Josephine County have to hire for all of this work?
Hello again. I think I can answer that question. Just for the food pool and lodging duties, it's one additional person to cover the inspections for Curry County.
And I see that Christine
Thanks.
put a camera on. So Christine, please feel free to add more if you'd like to.
Yes, hi, I'm Christine Shepard, the manager for the WIC program over here. We have not had to hire anybody extra in the meantime. As of July 1st, we will be hiring a part-time person to cover local services out in Curry County.
Thanks, everyone. Here's a question. Will there be updates to Curry County's website regarding new procedures for obtaining health services?
Sure. So I can start with that and just say that as of the May 2nd date by which OHA began providing communicable disease, drinking water, Wic Services, and the food pool and lodging work, we did work with Curry County to update the website, and we also have a OHA Curry County specific website. That's www.healthoregon.org/Curry. We'll continue to work with the county as we make the final transfer of local public health authority to make sure that the website either is up to date or redirects to that OHA site that I mentioned.
Thank you, Kara. Another question, in respect to emergency management, will there be an emphasis on NGO, non-government organization coordination with emergency management in preparedness, in a preparedness sense, excuse me. Will there be OHA facilitation of this relationship?
Thank you. We haven't started working yet on what our new view for public health preparedness is going to look like, but we're very interested in talking to all partners in Curry County to make sure that we're making the best choices, and we are, again, very open to the options. What we really want to do is make sure that you have folks who can facilitate and make sure that there's bridges between the various community-based organizations and government organizations so that we're keeping people as safe as possible, particularly in our minds right now in wildfire season.
Thanks, Colette. Summer Madison asks, by what means will public health related information and notices be communicated to the public of Curry?
And that's something I could probably help with. Yeah. Thank you for that question. This is Jonathan with OHA Communications. I can tell you that we are communicating with the county at every opportunity, the county, residents of the county at every opportunity. We have distributed press releases, a couple of press releases when we have updates to the transfer process. We will be providing a press release about Wic Services, just kind of a reminder of the Wic Services that Tiari mentioned, just letting people know where they can access those services and give contact information. And we'll just be giving regular updates throughout this process to make sure everyone knows what's going on. As Kara mentioned too, we have the website. We will, be updating that regularly. And of course, we want to hear from you as well. And any, anything you want to get more information about, you feel like the community would like to hear more about, we'd like to hear about that so we can, think of ways to get that out. So I don't know if any of the other panelists have anything else to add.
I would just also add that our kind of informal program connections and networks that we have, both with providers, community-based organizations, and others, and I'm sure many of you on the line this evening are contacts that we'd like to be able to share information as well as hear from over time so that we can be responsive to community needs.
And I would just want to jump in on that and say, we really want to learn from you how we should be communicating with you. And so please take the time to let us know what's the most effective method.
Thanks, Kara and Colette. Beth Barker Hidalgo asks, how can CBOs, community-based organizations currently contracted with the OHA for COVID response, help with non-mandated, non-medical services?
I can start, and then I would invite my colleagues to also add in from their specific program perspectives. But as I shared, our connections with community-based organizations within the county is absolutely essential, particularly as we're trying to reach our goal of eliminating health inequities by 2030. And so the communities that you help to support and the networks and trust that you've built are really essential for us to be able to move the needle on that for Curry County. I think that there are plenty of ways that we can explore working together, whether that's sharing information, being able to engage with community as we're starting to make plans or potentially respond to communicable disease outbreaks and so forth. There could be many, many touch points and opportunities to work together beyond the COVID-19 response specifically.
Thanks, Kara. Oh, go ahead.
I was just going to add, Kara, you summed it up well. And I think, again, what we need to know is how best to reach you to communicate, because what we're going to need to do when there is a public health emergency, outbreak or other, is to get together quickly to talk about what is needed, who is most vulnerable, and how we want to plan together to bring in resources to actually take care of your communities. So, so it's that effective and fast communication that we need to get to, and we need to get comfortable gathering without all the answers, but with a good community conversation.
Thank you. Sarah says, thank you for your answers. I too would like to know if the BCC program will be available to Curry County members.
That is a great question, and that's something that we would love to be able to explore with our provider community as we establish more of those connections over time, just like Reproductive Health Services.
Thanks, Kara. Maggie House asks, what needs would be most useful to fulfill from community partners?
So I'll start again. I think understanding what the community strengths and needs are related to public health services and being able to establish that touch point with us and with our programs, with the Josephine County staff, of course, that are going to be helping to provide some of the services is going to be really critical. We want to hear your voices. We want to know the best way to connect, the best places to locate and build connections to public health services. So I think that to me, that communication link is first and foremost in terms of how we want to work together. And certainly anyone else can add to what I have shared.
Thanks, Kara. Katrina Upton asks, can you explain what procedures OHA plans to provide in case of wildfire in Curry County?
Andre, do you want to take this one?
Yeah, thanks. I think our primary responsibility in wildfire is communicating the risk of wildfire smoke to the community, and we'll work with local governments and municipalities within Curry County and Curry County Emergency Management to let people know about those risks to wildfire smoke, as they occur, or hopefully right before they do impact people. And we do monitor health impacts associated with wildfire smoke. So we do monitor emergency department visits for things such as increased rates of asthma or other respiratory, conditions associated with the inhalation of smoke.
I would only add that we also work with your health systems and hospitals to evacuate, to help coordinate evacuation when needed. And that is something we've had to test before.
And this is Jonathan with Communications, and I'll just add that we also during wildfire season and before as well, we do a lot of communication about what people can do to keep themselves safe. Resources that they can access, places they can go to get away from the smoke, how to protect loved ones, neighbors, friends, and so that is happening throughout wildfire season. So, and the other thing I wanted to mention too is there are resources from our partners at other state agencies. There is the Smoke blog. You might have heard of, and other resources that we regularly communicate about as well. So we're all sharing information to make sure people can have as many options as possible to keep themselves safe and healthy. Okay, so the next question is, shouldn't all this have been done before a turnover date was set? With only 10 days to go, listening to one of our speakers, it really doesn't sound like we're ready to take over. And to other as well, just starting. It sounds like we're just starting. You want to take that comment or question?
Yeah, so I'll back up and just say that for nearly all of the services that we are required to provide on the OHA side, OHA has been providing since May 2nd. So the only pieces that I think we spoke to this evening are things that are work that we would be taking over from the county around assuring access to some of the clinical preventive services, and then everything else. We have been working closely with Josephine County since before May 2nd, and we'll be continuing that work for the longer term as well.
Thanks, Kara. We have a great comment from Beth Barker Hidalgo, and she says that our organization, the Curry County Homeless Coalition, can offer assistance in the area of outreach, prevention, and possibly response to communicable diseases within the unsheltered community. So thank you for that comment, Beth. Does anyone want to comment on that?
Only with gratitude. They're a great organization and great partners, and Curry County is lucky to have this group of people.
Thanks, Colette. Starla Paris says, I work for ODHS SSP as the Coos and Curry Partnership Coordinator. Would like to be on any communication emails our office typically has walk-in and phone calls regarding all services in the county. So that's a great suggestion, Starla, and we'll work on that. So just waiting for other questions or comments here. We'll just take a moment. Looks like we have one more question or comment. This is from Summer Madison. Will there be services provided by OHA that were not provided previously by the Curry PHA, Public Health Administrator? Somebody want to take that?
I will start and then welcome others. So again, we are focused on the pieces of the local public health provision that are tied to OHA's legal requirements for public health services when there's a transfer. And so all of those programs we spoke to this evening have already been underway since May 2nd or will be fully implemented July 1. There are other services that we will potentially be looking at based on community need, and that's where you all come into play, as well as some areas where we'd like to really build stronger partnerships with the provider community for many of the programs that we have talked about today. So wanting to help build access to some of the programs like reproductive health and immunizations and so forth within the clinical provider community.
Thanks, Kara. Beth Barker Hidalgo says, thank you to all OHA staff who have stepped up to help Curry County in this time of transition. We are grateful for your support and guidance. Thank you, Beth. Again, if you have any other comments or questions, you can just submit them to the chat. You can also send an email to one of the email addresses I mentioned, and I will mention it again toward the end here. And it looks like we have another question coming in. And I think this will actually be the last question for this virtual town hall. This is from Michelle Carrillo. And a second here. And Michelle asks, can you share more information on services plan to address low vaccination rate for the county?
Anthony, I'm wondering if you want to jump in on this one.
Yeah, hello everybody. Anthony Nickerson, Surge Coordinator with the COVID-19 Response and Recovery Unit. Most of the community partners and providers that are on this call probably know me quite well at this point. So we actually recently just stood up some additional funding around, addressing some of this questions around vaccine confidence and just kind of low turnout rates around vaccines in Curry County. But we are also very understanding that things have just been moving quite quickly in the county recently, especially with this ongoing public health transfer. And we know that there have been a lot of questions, and just know that we have a strong partner base now in the county, and we have a regular supply of vaccine moving into the county. And we have been increasing the number of vaccination events throughout the county. And you should start to see those numbers climb in the near future.
Thanks, Anthony. Did anyone else want to add anything on that? Or? Okay, thank you. Well, that looks like was our last question. I'm going to share my screen here really quickly just to provide the contact information. I can do that here. Not sure if you can see my screen. Well, I had hoped to share my screen, and I apologize. I've had some technical issues tonight, and I really appreciate everyone's patience. The emails, once again, where you could send questions or comments, and again, we want to read them all, so please do so. The first one is PHD, as in Public Health Division, .communications with an S at dhsoha.state.or.us, or OR COVID-19, it's ORCOVID19.media at dhsoha.state.or.us. And I just want to say thank you to everyone who joined our virtual town hall to discuss the Curry County Public Health Authority transfer to OHA. We really appreciate all your questions and all your comments. And I want to thank our speakers and everyone who jumped in to answer questions. And I also want to just say thank you to our Health Information Center operations team for their technical support on this and really making this a virtual town hall happen. So thanks to them. And thank you, everyone. Have a great rest of the evening.